Because of RACSB, I'm in a good place in my life. It wasn't always this way when my mental illness and addiction took over. With the help of my therapist and psychiatrist, I'm in recovery, I have a job, I have my family, and I know where to turn when I need a helping hand.
Because individuals with mental health challenges and substance use disorders benefit from comprehensive services, the RACSB provides specialized counseling through individual, group, and family therapy at each of our 5 clinics. We serve children, adolescents, and adults. The RACSB also provides services in partnership with Drug Treatment Court, as well as on-site at the Rappahannock Regional Jail, Juvenile Detention Center, and probation and parole offices.
Because of the unique needs of each individual served by RACSB, our 5 outpatient clinics employ a multidisciplinary team of psychiatrists, a psychiatric nurse practitioner, nurses, therapists, and case managers. We work together to identify challenges and build support for recovery. Our medical team recognizes that medications are an important component of treatment and recovery.
For me, taking my medications is an important component of my wellness. Seeing my therapist and doctor regularly is also important.
Because you can't schedule a crisis, RACSB emergency service therapists are available 24 hours a day, 365 days a year to respond to individuals and their families. It's our role to assess individuals and determine the most appropriate treatment setting.
Because of the Rappahannock Area Crisis Intervention Team, members of law enforcement receive specialized training that better allows them to recognize the signs and symptoms of a mental health crisis and helps them to provide support and linkage to community resources. Our goal is to divert individuals from incarceration and into appropriate mental health treatment. Because of our partnerships with local law enforcement and Mary Washington Hospital, we are excited to expand our Crisis Assessment Center, which has relocated to the emergency department. It's available every day from 2 p.m. to midnight, providing law enforcement the ability to exchange custody of an individual under an emergency custody order at the center. This allows responding law enforcement to return to their locality quicker.
It's nice to have the added support of a case manager. She's knowledgeable of so many community resources and programs that I can access.
Because sometimes individuals need a little extra help, RACSB provides case management. We work with individuals to ensure their needs are met and they are supported to be successful in the community.
Because of RACSB, our community benefits from having a program like this for people in crisis. I'd much rather be in a home environment than a hospital, not to mention the great food. It helped me, and now in my role as a peer specialist, I get to share my story and help others know that there is hope for tomorrow and that recovery is possible.
Because we value community-based services that are welcoming and supportive, we built the Sunshine Lady House for Mental Health, Wellness, and Recovery as our crisis stabilization medically managed detoxification program. Guests are supported through their individual crisis with wellness tools and linked to community resources for their ongoing recovery.
Having Kenmore Club and the routine really helped me early in my recovery. It's a meaningful place for so many. One of my favorite activities is the membership unit and outreaching to others who may be struggling. It's important for them to remember that they are not alone.
Because of Kenmore Club, individuals with mental health challenges have a safe place to come each day that supports them with their recovery through employment, educational, volunteer, and recreational activities.
Of course, my goal is to live independently, but it's nice to have some help along the way. Sometimes it's nice to have the added support with maintaining my home.
Because of RACSB mental health residential programs, individuals receive the additional support they need with things we do each day: cooking, budgeting, shopping, and medical appointments. The added level of 24-hour staff availability helps individuals live as independently as possible within the community.
Because of RACSB, I now have a large network of friends.
Because of Project Link, pregnant and parenting women with substance abuse concerns are linked to community resources and provide additional support to strengthen their personal and family well-being.
Because of RACSB and their services here, I have 6.5 months clean. My daughter has been returned custody to me, and I have grown and developed into the person that I want to become, and am looking forward to working with others and passing on the experience they have shared with me to help other women in the future.
Because of RACSB, the parenting class here has made my sobriety a lot easier than being a parent. I'm more active with my child, and I'm more aware of what I'm doing with her, and I'm more happy.
Because of RACSB, I have support to work and do things I like to enjoy. Working is important because I like to earn money to buy things that I want. I have transportation services and a driver that I really like.
Because of RACSB, adults with an intellectual disability have options for residential services that meet their varying needs. RACSB operates group homes, intermediate care facilities, supervised apartments, and the sponsored placement program. Residents have beautiful homes and are supported to live as independently as possible while enjoying all our community has to offer.
Because of RACSB, I have a great place to live. Love my room, my roommates, and staff. We're like family. I like to have parties, go places, do fun things together.
Because of the Myers Drive Respite program, caregivers of adults with an intellectual disability can tend to family obligations, enjoy a date night, travel for work, or focus on emergencies while knowing their loved ones are visiting a fun and safe place. Our program helps alleviate stress on these families while providing individuals with an opportunity to gain independence and meet new friends.
I have an opportunity to attend Rappahannock adult activities and visit my friends. They enjoy playing games, working in the greenhouse, and doing things in the community.
Yeah. Awesome. Because of Rappahannock adult activities, adults with an intellectual disability have access to a day support program that values the importance of providing engaging community activities that foster social and vocational skills. Families know their loved ones are safely supported to explore the community and to enjoy activities that are important to the individual.
Because of RSCB, I also have extra help from Darcy to help me make sure I have everything I need.
Because of RACSB, individuals with an intellectual disability and their families are educated in the services and resources available to them. As support coordinators, we assess their needs, link them to their chosen services, coordinate services, and monitor for the individual satisfaction. This way they're able to have the good life that they want.
RSCB helps me to have a good, happy life.
Because of the Parent Education Infant Development Program's dedicated team of early intervention specialists, working directly with families, children participate more fully in their family and community activities. Our team of physical therapists, occupational therapists, speech therapists, special educators, and support coordinators work together to help minimize delays and help children realize their full potential. We place an emphasis on parent coaching and activities that support the child's development and participation in their daily routines.
Because of the P program, our family has learned a lot in how to help Jaden and get him to the developmental milestone that he's at today, and he's doing awesome. He's walking, minimal talking, but they're still working with us closely to get every need for Jaden met through every type of services they have, which they have plenty to choose from. Jaden's now 1 and 18 months, and he's doing awesome now. They picked us up right out of the NICU. They were fast in response and there for us whenever we needed them.
Because of Rappahannock Area Community Service Board prevention programs, local youth and their families are given the tools to make healthier choices, to avoid alcohol, tobacco, and other drugs, and to improve their overall well-being. Through Dare to Be You, Second Step, Too Good for Drugs, and Halo, and Media Ready, we work to educate youth and provide them with important decision-making and social skills. We also work with local coalitions and groups who advocate for a healthier community.
Hi, my name is Nurse Abby Lynch, and because of the programs presented by the Rappahannock Area Kids on the Block Puppets, children and adults in our community learn valuable skills for coping in a crisis. how to become a helpful bystander in a bully situation, acceptance of difference and disability, and the many tools taught in our programs for problem solving. And RAKOB performance is an unforgettable educational experience.
Because of RACSB, hundreds of community members are better able to understand and recognize mental health challenges. Through mental health first aid trainings, participants gain valuable skills to assist someone in crisis and link them to community resources.
Because of RACSB, nearly 600 individuals enjoy rewarding and stable careers. We value the experience, compassion, and dedication of RACSB staff members. As a large employer, RACSB contributes significantly to the local economy.
Exciting things continue to happen at RACSB. Upon completion of the renovation, the Wolf Street Intermediate Care Facility will be home to 4 adults with an intellectual disability who previously resided in a state training center. RACSB is expanding crisis services to children and establishing a program of assertive community treatment, also known as a PAC team. This multidisciplinary team of behavioral health professionals will work directly with individuals with severe and persistent mental illness in their homes with the goal of preventing hospitalization. It is because of RACSB, because of individuals like Judy and Brandon sharing their story, because of the dedicated and hardworking staff members, because of strong community partnerships, and because of your ongoing support, that individuals and families receive the support and assistance needed to work through a crisis, to be in recovery, and be successful members of our community.